Hey everyone, Jason from Back in Motion. Wanted to go through a quick video today on motivation and achieving good results with your rehab. So one of the key things that our physiotherapists look at when we're dealing with patients is we start out by trying to discover not only their goals and that, but what we call their significant emotional event. So a significant emotional event is a key motivating factor that we can use to help people commit to their rehab, commit to doing their exercises at home. So one of the examples I use, and this is from an actual patient that I've had in the past, was she presented with a knee injury. And so many people would think that one of the motivating factors for undergoing treatment could be to get rid of somebody's knee pain. However, we know from various studies that pain comes and goes. Its motivation power is actually really limited. So it's not a great motivating tool. Plus, as you get better, as the pain settles down, the motivation then is gone. So we need to find something that is longer lasting beyond that acute initial pain. We need to find something that's going to motivate somebody to make sure they not only get rid of that pain, but they push through that and push themselves to be even better than they were before that injury. So that's where the significant emotional event comes in. So that knee pain, okay, so you want to get rid of that knee pain. Why do you want to get rid of that knee pain? Well, in her case, it was because the knee pain stopped her from being able to run after work. Okay, well, why do you want to run after work? Well, if I don't run after work, I tend to stay at home, drink wine, and I'm worried about getting fat again. So for her, whether that was a reasonable association or not, she associated being able to run with being able to stay fit, being able to stay healthy, about feeling good about herself. So when we designed her treatment program, we're doing all the normal things we would to fix the knee, whether that be our hands-on treatment, our massage, dry needling, our corrective exercise, but we always tie that back to the reason or the significant emotional event behind her injury. And so in this case, it's how we can tie that back to her being able to run. So you need to do these exercises. We need to get you on the foam roller each day. You need to do your exercises at night. And we need you to keep your workout program. So we're just going to drop the lunges out, keep the squats. We just don't want to aggravate that knee. We're doing all this so that you can get back to running after work, so you can stay happy and not have to worry about, drinking wine to de-stress after work. And then as the pain's gone, we can now go, well, that's great. You've got rid of your pain, but what do we do now? We want to make that knee even better than it was before. We want to get it so that it's basically injury-proofed. So now we need you to keep going with that foam rolling. I know it's not hurting anymore, like the actual knee isn't hurting, and the foam rolling still doesn't feel great, but we need you to keep focusing on that foam rolling. So I want you to keep foam rolling each day. I want you to move along with this advanced set of exercises. So we've got you going with the basic stuff, but now we need to make sure those quads and those glutes are even better at controlling your movement and that you're even stronger and fitter so that you can keep running always after work. And you're not going to have an injury like this come along again to interrupt that. So that's a really brief example of what a significant emotional event is. And there's many other things. It could be as simple as, because they want to get back to playing at the grand final. They want to play with their kids. It's really important that I get rid of this injury or get rid of this pain because I need to be back at work. My team needs me to be there. And it's like, so we always want to tie that back in. And once again, if it's all about getting you back to the team or getting you back to the grand final, we then want to go, okay, well, if you can get back to that grand final, what can we do to make sure you don't get into this position again? We always want to tie it back to not just achieving a pain-free status. We always want to make sure that we give you or give patients the option for continuing that on so that they can self-manage and work towards having the best or the ultimate possible outcomes. And sometimes that is coming back in to have another visit with the physio now and then to sort of review, update their program, make sure they're on track, getting a massage or, even participating in Pilates and clinical exercise classes to make sure they're staying nice and strong. Other times it's just making sure that they continue to commit to themselves, taking that time out each day to do a bit of a stretch, do a relax, use their foam roller, that they're watching their posture at work, that they're keeping that in mind when they're doing their lifting, and listening to their body when they're doing their workouts. So as I said, once again, back to the start, always bring it back to the significant emotional event. don't just focus on pain or something really simple. We want to dig down and find that really emotional thing that we can tie their rehab back to, or tie your own rehab back to. Anything you're doing, whether it's a rehab or whether it's a fitness goal, tie it to an emotional factor within inside of you. Don't just say, I want to lose weight. Why do you want to lose weight? What's it going to make you feel like? Because that's going to be something that's going to motivate you much more than a few kilos on the scale of that. Because the scales will go up and down, pain goes up and down day to day, depending on what you do about it. But we want to have a significant emotional goal behind our rehab and our work. So once again, thank you for listening in. It's Jason from Back in Motion in Newcastle and Cessnock. If you have any problems, you can come in and see our clinic. We offer a free initial assessment for new patients. So you can come in, meet one of the physios or the exercise physiologist, get an opinion about what you need to do to help fix your problem. And we'll probably discuss a significant emotional event during that time. And then also you can stay on if you need to for any treatment of that problem that we can help you with. So I hope you have a great day. And if you need to book in, you can call us on 49527033, or you can duck into backinmotion.com.au and search for our practices right across Newcastle and the Hunter. We've got the Junction, Gateshead, Stockton, Corlette, Kurri, Cessnock, and soon to be a reopening in Charlestown. So thanks and have a great day.